Welcome back, everyone. I hope everyone's enjoying the series that Ryne and I have been recording on direct primary care. Today I wanted to talk a little bit about the importance of data. We obviously understand and we're huge proponents of data. How are you using your data to make decisions moving forward when it comes to your health insurance plan? And today I wanted to ask Ryne just a few questions about data. So Ryne, how do you guys at Strada, utilize data, and what are all the different ways that you guys use it?
Yeah, good question. So when we started direct primary care in Nebraska and Strada Healthcare in 2016, we realized as we started to work with some of our first employer groups that they were asking us questions that required significant data, and so we started to invest in technology and working with local software developers to come up with solutions on how could we report things and what things would employers want to know. And so we partnered with a bunch of people to figure this out. And we figured out that if you're going to, we talked in the past series about primary care as an investment. Everything else is a cost, right? If you're going to invest in primary care, what kind of things would you look for quality primary care to be a good payoff? We probably want people to use it often. We probably want people to be seeing their doctor, and from inpatient, you probably want their health metrics to improve. You probably want them visiting virtually with their doctor when they're at home or they're at work, and things like that. And so we developed metrics to where employers could, at a base minimum, get data on health metrics on their employees from a biometric standpoint, aggregate. You can't drill down to the per employee, but aggregate on our employees getting healthier. Are they using the service? Because we don't want an employer paying for someone that's not using it. It's not good for us, not good for them, and we don't want that. And telemedicine utilization is a big one as well. So from a base level, that's what we can do, because the rest of healthcare data lies in claims. And for direct primary care doctors, we don't file claims. And so what we're able to do, and we have the technology to do, is to plug in for an existing claims system through a third-party administrator to be able to review those claims for employers. So, for example, if you're a company and you've got employees, some of whom are on direct primary care, some of whom are not, a really important thing to look at would be, are my employees on direct primary care causing me fewer claims than my employees that are not? That would be the goal, right? Because we're hoping in direct primary care we can just take care of most of their health care and not file any claims. And so that's what we're able to do. And so we can report on a whole variety of metrics and claims to show, here's what's happening for your employees that are not on direct primary care. And we have numerous white papers on our website you could download to look at those things. I talked in a previous episode as well about upfront data analysis that we'll do. So we have a team that will do claims analysis. And essentially this is it's an Excel file that's a claims dump that's de-identified that we can go through, and we look for any primary care that took place, whether it was in a primary care office or not, what are emergency room visits that we could have avoided, and we provide a report back to the employer to say, here's kind of an idea of maybe some savings that you might be able to see. So there's a little bit of reporting on the front end, and then as we go, we've got pretty much as much data as an employer is willing to give us, we can report on. And we have dashboards as well that they can log in to see kind of, the general demographics of their employee base, the health metrics, and especially the utilization. The telemedicine utilization through COVID has been up over 1,200% in Strada. And we think, I talked in a previous video about the relationship that patients have with their docs in direct primary care. And I think with COVID, it was just a natural thing for them to use it more. And it's a fun metric to be able to deliver back to employers to say people are using this a lot and they're talking with their doctor. And the more they're utilizing primary care, the less chance they're going to be using stuff that would cause you high claims. So typically the barrier we see in reporting and data is when it comes to getting claims from a payer. As I'm sure many of you know, it's tough to get claims data out there. We will report on whatever we can get. We're only as good as the data we can get from you. So inside the primary care clinic, we can give you health metrics and utilization, like I mentioned. But anything that happens outside of the primary care clinic, we do our best to work with the claims payers to be able to report on that and then compare how we're doing.
Yeah, absolutely. Yeah, and as I mentioned, obviously, we understand how important data is. And within our philosophy, obviously, we're using the data to then create the strategies. And then developing the tools that are needed to then obviously execute. And at the end of the day, our goal is to not only, lower the cost, but also increase the benefits. And, without data, it's hard to do.
Well, it's interesting from a data perspective, even up front. There's a lot of employers that, frankly, I would say are spending too much money on wellness programs right now as a targeted, or not a targeted, a blanketed approach to say, well, we have a wellness program, so maybe this should help. And instead of focusing on, let's look at, if you can get the data, what kind of healthcare needs do our employees actually have? And how could we invest in money up front to maybe better this? So, we have employees that are, we have a lot of chiropractic claims. How could we work directly with some chiropractors to better the health of our employees or things like that? We always tell employers that help us be your wellness program, because we're able to we see your employees every day, and we know what they need to do, and we can help develop strategies for them. And a lot of times, whatever data you're able to get from your insurance carrier, your third-party administrator, can really steer the conversation around, what health initiatives could we take? And Strada is a big component of let your direct primary care doctors that are taking care of your employees be your wellness program. Let us come on site and do seminars and things like that. And so the more that we can get data even up front about what employees are looking for, the care that they're wanting and needing and accessing already, and then we can work on the back end to provide that for them, even in a wellness plan component, is always really fun.
Yeah, absolutely. And you mentioned, obviously, one thing in there. One way that we believe is a good way to do that is through employee surveys. And, not every employer are administering surveys around their benefits.
Right.
And, we believe that it's a very strong tool when it comes to understanding what your employees like, what they dislike, and then, what they want. And, you mentioned wellness programs, and I think that's a great example because, a lot of people think the solution is a wellness program. Well, it's not true with everyone, but we've come to find out that typically the people that use the wellness programs are the people that are healthy.
Sure.
So you made some really good points there, and I just wanted to ask one more question around data, because obviously, within our philosophy and how we, go about managing health plans, we're using the data to not only develop the strategies and, the tools necessary, but then, we're reevaluating it year over year, so we're able to predict claims, forecast claims over 12 months. And obviously we're able to make adjustments, when needed to obviously impact the cost, but also, increase the benefits. So how do you guys use your data? If you see something within the data, how do you guys, adjust, maybe your, strategy on how you're reaching out to employees if you're not getting employees to come in? Talk about how you guys use data to then make adjustments, to make sure that the direct primary care is beneficial for the employer. Right.
I would say that when it comes to how we dictate how doctors provide care, we trust that really good primary care is going to take place when the doctor is given more time with the patient. And if we have data like what it sounds like you all provide up front to say, we have this many, a certain segment of our patients are pre-diabetic or hypertensive, it allows us to then approach this honestly more from like a wellness program perspective to say, we should be doing more group sessions with your older guys to talk about hypertension in ways that they can be better. What happens for each individual to better their maybe chronic conditions or what's going on is going to be improved in the primary care setting, or it should be, and that's why we track the data. And so I would say that when we look up front to say, here's the issues that this group may have, we would work then with the benefits advisor to say, how can we track that and report on that to make sure that if it's hypertension or if it's diabetes or if it's mental health, frankly, how can we set up metrics that we can report on? What we don't want to do is get in the business of telling doctors, you need to check all these boxes in order to provide really good care for these patients because we know better than you what they need. That's what insurance companies have been trying to do, and it doesn't work very well because you then require a doctor to spend 60% of their time filling out. So we instead on the front end focus on recruiting really, really good primary care providers that we know are going to take holistic care of someone and focus on prevention, trusting that all those things are going to get taken care of. And then from an employer approach, we think, how could we revamp this wellness program and make it run by your direct primary care doctors instead, and providing more education on those more health-related topics. And then we can report to the leadership team and to you and to say, here's how many, here's the average blood sugar of your females over 50 when we started versus when we ended, and be able to report that to people. So again, to your point, data is really important. As much as we can collect on the front end and the strategy sessions like you talk about, have strategy sessions to then say, how can we report on this? And then trust that really good primary care is going to be taken care of in the doctor's office. And there is a certain amount of trust in any investment that you make, right? You do your due diligence, but you trust that it's going to take place. And with Strada, we trust that when you remove third-party payers and insurance and barriers to care between doctors and patients, and you just let doctors do their job, good things happen. And then if you augment that by letting those same doctors help run your wellness program, things just get really, really, really cool.
Yeah, absolutely. Again, it's one way that you can, ensure that your employees are staying healthy and they're getting the care that they need, because, we understand obviously with the current healthcare system that we have, it can be challenging for an individual to navigate the healthcare supply chain. And, without some guidance, the average individual, doesn't spend a whole lot of time looking into it.
Sure. Yeah. And with direct primary care, your physician, your personal physician is now your guide to the healthcare system, because you're paying them a monthly fee, or your benefit for your employer is they'll spend as much time as you need with and be able to help you navigate. And and then on the back end, if the physician maybe doesn't understand something about your plan design, we're then able to plug them in with the correct people in the health system to help them navigate it, because it is impossible to navigate the system for your average Joe. And the ability to at least, at a minimum, know that your primary care doctor is in your corner and wants the best for you, health-wise, financially-wise, and has the time to help guide you and point you in the right direction is really, really important, because outside of direct primary care, docs just struggle to do that. And if they're doing it, they're not getting paid for it. And they're doing it out of the goodness of their heart. So, we're, like I mentioned earlier, we're really passionate about working within an employer's plan design to do whatever we can to steer care to high quality, low cost centers, and the best financial outcome for the patient, as well as the best health outcome.
Absolutely. Yeah, well, I appreciate all of this information. I appreciate taking time to shoot these videos with me. As I mentioned in my previous video, if you guys want to learn more or have any questions about direct primary care, feel free to reach out to me and I'll put you in touch with Ryan. Obviously Ryan and Strada is very passionate about it, but we here at Ellerbrock-Norris, we do understand the value that direct primary care can bring to individuals and also to employers. So I appreciate everyone listening in to the series. Again, if you have any questions or want some more information, feel free to reach out.
Thanks, Phil.
Thanks.